You've seen them, right? Those perfectly round, dark circles on an athlete's back, and you're thinking, what on earth happened there? Well, those marks are from cupping, and it's an ancient therapy that has a completely different take on what a bruise is. So what's really going on? Let's explore this idea of the healthy bruise, because it might just change how you think about healing.
So here's our plan. We're going to start by totally reframing what a bruise can mean. Then we'll look at the two big theories behind how cupping works, one that's more scientific and one that's all about energy. We'll get practical too, looking at who this might be for and, just as important, who should probably steer clear. After that, we'll dive into how the body's energy channels are mapped, which all leads to the final goal, restoring the body's natural flow.
Okay, so let's start with those marks. You know, here in the West, we see a bruise and think, ouch, injury, gotta fix that. But what if it's actually part of the healing process? This is where we see this huge split in thinking.
I mean, this quote from our source material just flips the script completely. It's suggesting that a bruise isn't some random accident that needs to be fixed. It's a purposeful action the body is taking. It's not damage, it's a sign that the body is actively working on something. Pretty cool, right?
This really gets to the heart of it. Is a mark on your skin a problem we need to eliminate? Or is it a purposeful process we should be using? I mean, we're talking about a completely different philosophy of how the body works and what healing even looks like.
And here's a really crucial point from the source. It argues that these marks aren't your typical bruises, from broken blood vessels. They're actually called extravasculates. What that means is the walls of the vessels stay intact, but they become more permeable, letting things pass through. That's a huge difference in what's happening physiologically.
So, if that's what the marks are, the next big question is, why do they appear? And the source material lays out two really fascinating and very different explanations for how cupping actually gets its results.
So, the modern scientific view looks at cupping as a physical thing. The vacuum creates this very targeted, very controlled little bit of, micro-trauma. This basically sends a signal to the body to ramp up blood and lymph flow to that spot, bringing in all the good stuff and flushing out waste. Some research, like from the Soviet therapist V.H. Vasilenko, even showed it can kick off a bigger immune response. It's like creating a powerful, localized healing zone.
Now, the traditional theory comes from a totally different worldview. In this framework, health is all about flow. Sickness, that's stagnation. The idea is that our body is filled with a life force called qi that moves through specific pathways. So when you're not feeling well, it's just a blockage in that flow. Cupping, then, is the tool you use to break up that stagnation and get the energy moving freely again. Okay, so we've got these two theories. How does that translate to real life? Let's get practical and look at who might actually benefit from cupping, and, just as important, who should absolutely stay away. This is the million-dollar question, isn't it? And lucky for us, the source material gives us a pretty detailed look at both sides of that coin. But wait, before we go any further, there's a really critical disclaimer right from the source itself. This is not a medical textbook, and any treatment you're thinking about needs to be discussed with your doctor. Seriously, it's so important to talk to a physician before trying any new therapy. All right, first up, the hard nose. The source is very specific here. Cupping should be avoided in certain situations, like if you have a high fever, or more serious issues like tumors or severe cardiovascular diseases. Also, it's a no-go in the later stages of pregnancy. As you can see, safety is absolutely priority number one. On the flip side, the source suggests a really wide range of potential uses. We all know athletes use it for things like back pain and muscle recovery, but the list is actually pretty broad. It covers everything from neurological things like headaches to chronic respiratory conditions and even cosmetic stuff like skin toning.
Now, to really get a handle on that Eastern theory, we have to understand its map of the body. It's not just about muscles and bones. It's about a complex, invisible network of energy. The easiest way to think about this system is to picture your body like a city. The meridians, those are the major highways, and that vital energy, the qi, is all the traffic that needs to flow smoothly on those highways for the whole city to work right.
And each of these energy highways is linked to different body functions. But look how connected everything is. The lung channel, for example, isn't just about breathing. It's also tied to your skin's condition. The bladder channel relates to the excretory system, sure, but also to things like blood pressure. It's a truly holistic view where everything affects everything else.
So we have the map, we have the highways. What's the point of all this? What's the ultimate goal? Well, it all comes down to one word: movement.
Sticking with our highway analogy, illness is basically just a traffic jam. That's it. When energy gets stuck and can't move, problems start to pop up in whatever part of the body that highway serves. The whole goal of the therapy then is to be the traffic cop who gets in there and clears the jam.
So the process makes a lot of sense. First, you figure out where the traffic jam is. Then, you use your tool, the cup, on a specific spot that can influence that highway. This stimulates movement, both of blood and energy, it clears the blockage, and boom, the whole system's natural balance is restored.
And this really gets to the core principle. From this perspective, a headache isn't just a headache, it's a symptom of a deeper blockage somewhere. The goal isn't just to treat the leaves on the tree, it's to nourish the roots by fixing the underlying flow so the problem doesn't keep coming back.
So that leaves us with this question, doesn't it? Is cupping just an old folk remedy that causes a physical reaction? Or is it a key tool in a really complex, sophisticated system for managing the body's energy? The source presents both views, leaving us to wonder if maybe, just maybe, the truth lies somewhere in that fascinating space where the two meet.